At the EHA meeting 2021, we have results of our Phase II study of Zanubrutinib in patients with previously treated B-cell malignancies who were intolerant to either Ibrutinib or Acalabrutinib or both. So the idea was to see if Zanubrutinib as a second-generation BTK inhibitor could be better tolerated in patients who had to stop Ibrutinib or Acalabrutinib. Remember that these patients could not have had disease progression on one of the two drugs. So this is really a study that tries to see how feasible and how reliable Zanubrutinib is in the post-Ibrutinib, post-Acalabrutinib when patients switch because of intolerance. So we presented the first basically results at ASH 2020, and this is a larger number of patients at two cohorts, Ibrutinib only and Acalabrutinib exposure, so the second cohort. A total of 64 patients. I would just say maybe the take-home message is that the Zanubrutinib was very well tolerated in both cohorts. 75% of events, intolerance events on both Ibrutinib or Acalabrutinib did not recur on Zanubrutinib, which is, I think, a clinically meaningful number. 75% of patients of adverse events that or led to the discontinuation did not occur. With the events that recurred on Zanubrutinib, 90% of those from the Ibrutinib cohort were at the lower grade. 33% of the AEs that happened on Acalabrutinib were at the lower grade. And 10% of the Ibrutinib side effects and 60% of the Acalabrutinib side effects recurred at the same severity. We did not have any event that recurred at a higher severity, which, again, this only happened in smaller percentage of patients that they had the recurrence of AEs. But even if it happened, it was either at the lower grade or the same grade. So we did not have a higher grade toxicity on Zanubrutinib. None of the patients had to stop the drug because of intolerance. And of course, the drug remains to be very effective, and disease control was really high. And so I think that this is an important study in showing that patients who did not tolerate Ibrutinib or Acalabrutinib, Zanubrutinib could be a viable option. The study will focus from now on more on patients who came off Acalabrutinib for intolerance issues, and hopefully we'll have more data to present in future meetings or in form of publications.